Talk about the need for more precision within that diagnosis, but I'm wondering if there are consumers out there who are dealing with back, neck, or joint pain to some extent, or clinicians who treat patients commonly with those complaints, and they think, well, there are diagnoses. We've got, fracture, and there's, bulging herniated discs, and there's, someone who thinks that they have a lack of core stability, and those are pretty popular, categories. And so aren't those diagnoses?
No, they're theories.
Okay.
You're right, they're popular, but they're theories. And if you buy into the theory and you adopt the treatments that are recommended for those things, a certain number of people recover, but many don't. And so what we're looking for, when I talk about a precise diagnosis, I use the definition that Clayton Christensen uses in his book, The Innovator's Prescription. And his definition is that a precise diagnosis is one that identifies a type of care that also identifies a treatment that predictably and effectively treats that problem. And so you don't have a precise diagnosis unless you have a solution that works. Mm-hmm. And so, and when I read that book years ago, I said, wow, this is MDT. Because we can make a mechanical diagnosis that identifies a predictably effective treatment that addresses the cause, not just the symptom. Mm-hmm. And so it's the perfect fit for MDT. And so, I fell in love with Christensen's work. And so that is a completely different approach to evaluation and diagnosis than the conventional ways of doing it, which for the most part are anatomically focused. Can we identify the structure where the pain is coming from? Well, we've learned through directional preference, we don't care what the structure is. If there's a directional preference and we can centralize and abolish that pain, we can talk all day about what the explanation is, but we've solved the patient's problem. We've made a mechanical diagnosis and we found a predictably effective treatment. And that's the literature now. There are enough studies that show that that's possible in 80 to 90% of the acute low back pain. Well, yeah. That's quite a contrast from the 15% that we say we can diagnose with conventional means. That's a six-fold difference.
And hear the entire episode for free on iTunes, Spotify, other favorite podcast players, or go to mechanicalcareforum.com.